But at the point of consumption, healthcare consumption, the elderly needs and the young people's needs are quite different. Young people, they got whatever, get into hospitals, if they have good standard of care, after a few days, at most a week, discharge, back to status quo ante. But elderly, the illness is still with the elderly. And therefore, if it is prolonged stay in hospitalization, first it's costly, second it's unnecessary, and it is an absolute risk to infections and all sorts of other viruses which are dominant in the hospital environment. And therefore, it is how do you care for them outside of hospitals, which I think make a critical difference in the healthcare delivery system. So what we have been actively planning the last 5 years, and going forward this will take us another decade, is how do you organize healthcare outside of hospitals? And yet in a way, not in silo form. You must be able to integrate properly between the acute hospital specialists and the many specialists outside in the community. And the ability to organize and integrate, and technology helps. Therefore, projects like National Electronic Health Records are important strategic platforms, because only by that way you are able to look at the same view, even though we come from different employers, different interests. I'm a GP, you are a hospital subspecialist, but we look at the same patient and we treat this patient as a team. And to be able to do so, we must share the same information. So a lot of this infrastructure has to be put in, but more importantly is mindset. As a hospital specialist, it's a long time, for a long time it is, I look down on the other players outside. But now the future is, we are all partners in this.
So the mindset is something
really mindset is critical, and likewise mindset of the patients. Because there's still, I think it's better, even the smallest problem, I go to the hospital, when actually you may find that the cheapest and the most correct care is to your family GP. So have one whom you trust, that you have a long-term relationship, who knows your family, your background, who is also in contact, when necessary, with the hospital subspecialist, and who can help you navigate the very complicated healthcare delivery system.